Welcome everyone to a presentation on Bring Your Own Device. My name is Amie Cockrell and I'll be spending the next 5 to 10 minutes outlining the implications of personal mobile device use and special considerations as it pertains to the healthcare industry. Thanks for joining me. So, what is BYOD as in dog, not B as in, well, you get the picture. Bring Your Own Device is the practice of allowing the employees of an organization to use their own computers, smartphones, or other devices for work purposes. I'm a number and data person, so let me share a few statistics with you. Currently, there are over 45,000 apps in the Apple Store related to e-health. The years 2017 to 2020 are projected to have the most growth in the BYOD industry, especially within healthcare and finance. A majority, 59% of companies currently have BYOD policies in place, and employees and executives agree that device utilization will increase in business environments in the coming years. So advantages of embracing BYOD can really be highlighted through cost savings, enhancing employee satisfaction, reducing dependence on IT, and improving productivity. So again, let's look at a few more statistics. 53% of employees believe using their own device makes them more productive. So they don't have to worry about learning a new system or learning a new device. Most likely they're already familiar with how to navigate through their own devices and the functionality. And, who hasn't been guilty of maybe checking a work email while on vacation or maybe just riding the elevator? So having access to those personal devices has proven to increase productivity. Also, time savings. So 69% of managers have reported being willing to allow BYOD because it does save employees time. So an example of this related specific to healthcare is CPOE. So as we are challenged to increase utilization for physicians to directly interact with the electronic health record, having access through personal devices will cut down on the time that they might have to spend actually coming into a hospital or care environment while they're on call to review labs, place orders. So having access to their own personal device for those tasks obviously would provide some time savings there. Average annual cost savings have been estimated at about $350 per device per year, as some of the expenses of maintaining devices or paying for data plans can be shifted to the employee, but we'll talk about some caveats later on in the presentation. And then 87% of companies have reported that they already are, to some extent, already dependent on employees' ability to access mobile devices, whether this is through applications to record time and attendance or through HR portals where they can, review their pay stubs, things of that nature. So again, advantages are multifaceted. As expected, challenges center around security and control, HIPAA, and implementing effective policies. By allowing employees to use their own devices, companies are relinquishing a substantial amount of control and information security to their employees. In doing so, companies are relying on staff to keep their software systems up to date, applying discretion on where and how to access potentially sensitive information, for example, on unsecured Wi-Fi, and being responsible in reporting the potential risk, threats, or breaches in security. And probably the greatest concern in healthcare is maintaining HIPAA compliance. And because HIPAA and cloud services aren't necessarily the main subject matter of this presentation, I won't belabor the point, but HIPAA requirements do extend to any media which holds patient information, and organizations must demonstrate overt safeguards on personally accessed devices, which brings about another main challenge related to effective policy implementation. So prior to implementation of any accessed services on personal devices, organizations must have clearly established policies that outline appropriate use and reduce any gray areas in business and personal privacy boundaries and outline what security protocols must be followed. Effective policies are necessary to establish clear expectations of the employee and employer responsibilities related to device use and management and outline clear plans regarding risk mitigation. So effective policies should address at least these 7 components. Specific devices, so are Apple, Android, or Microsoft products allowable? Required security controls, will encryption, password, or biometric protection be required? Service and support. What support will be provided by the company and what support will companies or will employees be expected to obtain on their own? Data ownership. So there have actually been some interesting court precedents set here in Texas that have provided clear understanding of who owns data. And if you're like me, you might be surprised at how much control over information companies can maintain on personally owned devices. I'll include some additional resources and links at the conclusion of this presentation if anyone has more interest on this topic. Apps that are allowed and restricted, acceptable use protocols, and employee exit plans. So this means having clear guidelines on the steps that will be implemented when employees separate from organizations. There are technologies out there that allow company and personal data to remain partitioned on electronic devices and give companies control to wipe information on devices personally owned by employees. Again, I'll refer you to the provided links at the conclusion for more information on this topic. So real quickly, let's look at some other important considerations. So 69% of companies currently reimburse employees for work-related use of smartphones, and they report doing this to increase employee satisfaction, attract new employees, and to remain compliant with applicable laws. So the average monthly reimbursement rate is just over $71 per device that's being used personally. However, 32% of employers are concerned about calculating the correct amount of reimbursement. So whether that's through fixed rate stipends each month or allowing employees to manually calculate a reimbursement based on utilization, there is still a little bit of concern about arriving at the right reimbursement number. And then there's also considerations for overtime costs. So as employees are becoming more productive and using personal time for work, it might be time to brush up on regulations related to compensated and uncompensated work time and to have considerations for increases in overtime. So what are some key takeaways? Utilization is increasing within the healthcare industry, and the healthcare industry is expecting a majority of the projected growth. Advantages include decreasing costs, increasing employee satisfaction and productivity, and allowing the ability for time savings. Challenges include security and control, HIPAA compliance, and establishing effective policies and implementation strategies. And legal implications must be taken to ensure that employees are reimbursed and appropriately compensated per state laws. Thank you for your time, and I appreciate any comments, feedback, or questions you might have regarding this content. I look forward to the other topics that will be discussed, and thank you again for your time.